Hello, everyone. My name is Fawaz Al-Mufti. Welcome to the Society of Vascular and Interventional Neurology's Mission Thrombectomy World Stroke Day webinar. I'm truly honored to welcome you all here as speakers and attendees. Um, uh, we're doing this today to commemorate World Stroke Day. World Stroke Day is a time to honor stroke victims and their loved ones. It's a time to retell their stories of resilience, the hard-fought battles, and the challenges of recovery that stroke patients and their loved ones had to endure. It reminds us that hope and strength lies in recognizing the courage of those who face this journey every single day. We're going to talk today about a topic that is near and dear to my heart, mission thrombectomy. Um, I am the chair of mission thrombectomy, which is the advocacy arm of the Society of Vascular and Interventional Neurology. And we're going to talk today about increasing access to mechanical thrombectomy and advanced stroke care. I have no relevant disclosures other than the fact that I'm very passionate about what I do. So this is my very clear bias. Every year, almost 800,000 individuals will have a stroke in the United States. And on average, every 40 seconds, someone in the United States has a stroke. Globally, 1 in 4 individuals above the age of 25 will have a stroke in their lifetime. And over 12 million people worldwide will have had their first stroke this year. And over 100 million people in the world have experienced a stroke. On average, every 4 minutes, somebody died of a stroke. And globally, this year, 6.5 million people will die as a result. By the end of this talk, 30 individuals will have a stroke and 5 people will die due to a stroke. So I'd like to start by putting things in perspective. Globally, we said 13.7 million strokes occur, 9.5 million strokes of these are ischemic strokes. 5.2 million stroke-related deaths occurred in 2017, making it the second leading cause of death globally. And 116 million healthy years of life were lost due to stroke this past year alone. Stroke is expected to be the leading cause of disability by 2030. And to put things in perspective, when I go and speak with key policymakers, I like to talk about the COVID-19 pandemic. COVID-19 pandemic, although a tragedy, should never have occurred. However, it killed 6.17 million deaths over the course of 3 years, making stroke 3 times like a stronger or bigger or more like formidable killer than the COVID-19 pandemic. So we faced 3 challenges, triple challenge of expanding mechanical thrombectomy access globally. 1, the unpredictability of the occurrence. 2, the presence of poor recognition. And 3, that this needed a time-sensitive outcome. In order for us to, we asked ourselves a question: how is this not when does a treatment need a public health intervention? When do we decide that this treatment needs to be apologies. My apologies, I got interrupted, an emergency call. But so we asked ourselves, when does a treatment need a public health intervention? Treatments can be considered in need of public health intervention if some criteria are met. It has to have a large health burden, getting larger. The burden has to be distributed unfairly. There is a highly effective and safe treatment for the condition. The treatment is cost effective, and there must be evidence that upstream preventative strategies could substantially increase access to the effective treatment. And finally, there's a tangible societal cost. Mission Thrombectomy was established in 2016 as a metric-driven umbrella campaign under the International Society of Vascular and Interventional Neurology. Our mission was to accelerate access to mechanical thrombectomy for large vessel occlusion strokes globally. And the approach was to collaborate with worldwide stakeholders, providing peer mentorship, especially in low and middle income countries. The leadership team is comprised of interventional neurologists, vascular neurologists, endovascular neurosurgeons, interventional neuroradiologists, neurointensivists, and emergency medicine physicians. The mission thrombectomy is comprised of a core executive committee, Additionally, in addition to a global executive committee with individual country liaisons and regional committees globally. At this point, as I'm speaking with you, we have almost 107 regional committees. Mission Thrombectomy is also comprised of multiple subcommittees that work together in concert to essentially enact our mission, enact our vision. As I mentioned, we are in 90 countries and with almost regional committees with almost 107 regional committees in 90 countries with 600 members within Mission Thrombectomy. So we asked ourselves, and like we're firm believers in Peter Drucker's saying that you can't manage what you don't measure. So one of the first things we did was essentially we wrote them empty glass paper. The empty glass paper is the Mechanical Thrombectomy Global Access for Stroke, a Mission Thrombectomy study. This was a survey that went to 67 countries, 89% response rate, and we basically found that global mechanical thrombectomy access is very low, 2.79%, less than 1% access for 18 countries, with a 460-fold disparity between the highest and the lowest access countries. Also, there is 88% lower access in low-income countries compared to high-income countries. And income level is a significant predictor of MT access. The socioeconomic factors, healthcare infrastructure, cultural barriers, and availability of trained operators were some of the most impactful predictors of who had a lower mechanical thrombectomy availability or access. Mechanical thrombectomy access rates by income and country, assuming 20% of all strokes are large vessel occlusion strokes. Bahrain, Qatar, Singapore, the United States, Japan, New Zealand had the highest mechanical thrombectomy access. And almost a third of countries in the surveyed countries had mechanical thrombectomy access of less than 1%. So overall, the Mission Thrombectomy Initiative, with over 100 regional committees working to improve stroke care access, published evidence-informed white paper on mechanical thrombectomy. We've launched a teleobservership, teleproctorship program. We've established a day to commemorate mechanical thrombectomy, the World Stroke Thrombectomy Day. We have a consultancy service, awareness campaigns that have also been launched. We are currently, the white paper has been translated into 20 languages, with French and Urdu currently in process. Advocacy is our middle name. We've contributed to policy change in India, and we do not take credit for this. However, working with our partners on the ground in India, the reimbursement for mechanical thrombectomy almost tripled in 2022. In China, between 2018 and 2024, you can see that there's been a steady rise in mechanical thrombectomy access. And this was, again, we do not take credit for this. However, we worked very closely with our partners on the ground to essentially enact these changes. The Mission Thrombectomy Regional Committee Award recognition is something that we've launched over the past 3 years at the International Stroke Conference, where we give awards to diamond, gold, and platinum recognition to the regional committees that are making the most changes. And you can see these are all the countries that have achieved this, and we're looking forward to giving even more awards this year at the Society of Vascular and Interventional Neurology annual meeting. We've also brought together a coalition of neurointerventions, the GNIC Mechanical Mission Thrombectomy Initiative. We met the first time in 2023 in Miami, and we're planning another meeting in 2025, where we bring in all neurointerventional societies and all societies focused on neurointervention, on mechanical thrombectomy, all to sit on the same table so we can advocate together. These are all our members. So one of the things that we decided to do was essentially double down when it came to stroke care and stroke access. Our initial approach was a grassroots movement was essentially to empower and enact change through our partners on the ground. However, we learned that our vision was essentially to double down using a top-down approach to advocacy, leading to the establishment of 2 key subcommittees. The MTUS Advocacy and Policy Subcommittee focused on enacting a standardized curriculum for EMS education and advancing federal advocacy efforts, and established an annual mechanical mission thrombectomy day on the Hill, focusing on meeting with lawmakers and advance policy. And the second committee that we did was the Global Advocacy and Policy Subcommittee, the GAP committee. This was essentially focused on advocacy at the UN and WHO level, as well as building strong relationships worldwide with governments worldwide. Looking ahead, we're planning on organizing an event at the 2025 NYC ECOSOC WHO meeting, which is focused on healthcare, to further amplify our global efforts to establish mechanical thrombectomy as an essential surgery. And in August 2023, the esteemed United Nations Economic and Social Council granted SVI and emission thrombectomy the prestigious special consultative status. This consultative status allows us to participate, comment on, present, and consult within initiatives and commissions of both ECOSOC and the United Nations. And last May, Mission Thrombectomy was invited to participate. Mission Thrombectomy was invited to participate at the World Health Assembly satellite event for mission thrombectomy in Geneva, Switzerland, where we met with Dr. Tedros, the Director General of the World Health Organization, during the WHO's Walk the Talk campaign. Our goals for 2025 is to secure the designation, the WHO designation, as a non-state actor, so that we can still exert influence on state actors. Securing this designation would provide mission thrombectomy in the Society of Vascular Interventional Neurology, and quite honestly, all of our partners focused on this, with an opportunity to actively participate in global health discussions, advocate for stroke care, particularly thrombectomy-related policies, and to collaborate on forming coalitions and with other health-focused organizations. This would position SVIN's mission thrombectomy as a key voice in shaping global strategies and policies that can improve stroke outcomes worldwide. And with that, I will end my talk, and thank you all. I'd like to thank you all for attending, for all the speakers for being here, and I look forward to listening to all of your talks, and I want to thank all the attendees for being with us today. I'd like to also welcome you all to join the society, to attend the Society of Vascular and Interventional Neurology's annual meeting. An area that may be of interest to you all is will occur on November 22nd, Friday, which is when we will have our Global Stroke Day, with sessions on stroke economics, a joint session with the World Stroke Organization, as well as a mission thrombectomy session, and finally a stroke interventional lab certification session workshop that I think would be beneficial to all of you.